In this episode of To Your Health, we interview Dr. Hogg about the heart connection to deep vein thrombosis, diabetes, and peripheral artery disease, as well as some of the different procedures Dr. Hogg offers to help with those. Welcome back to the San Antonio Woman Podcast, To Your Health series, sponsored by Partners. I'm Katie Goodman, joined here by Dr. Hogg, doctor and owner of the Medical Vein Clinic.
Yes, ma'am.
So happy to have you back. We had some really good
pleasure.
Conversations.
Thank you.
Yeah.
Well, I hope you are celebrating your pet today.
Yes.
Yeah, today is, as we film, is National Pet Day.
I know. That is, I'm always celebrating my pets. I have 3 dogs that take up a lot of my time. I love them so much. But what about you? I
have 3 too.
Okay, yay.
I have 3 Vizslas. They're little redhead bird dogs, and they're Hungarian hunting dogs. And they love squirrels and birds, and so we have a lot of chasing and barking, looking up trees.
Yeah, they are high energy
They
pups,
are.
aren't they? Man.
And they say they're the Velcro dogs. They're like, stick next to you. They sleep here and here.
Yeah.
They're going to be touching you all the time.
I was going to say that I'm getting Vizslas and Rhodesian Ridgebacks mixed up. The Rhodesian Ridgebacks have the hair going the other way, right?
That's right.
Vizslas are,
and they're similar, the same color. They're redheads, which are beautiful.
Yeah, so pretty.
But the Vizslas are a little bit, about a third smaller, and they're more, real mobile bird dog size.
Awesome. Yeah, in our last podcast episode, we talked about how you owned a doggy daycare for a while. It went national. You were one of the first in the United States to own a doggy daycare. I just think that's so cool. Yeah, it's
kind of fun.
The ways in which we end up where we are.
We are. Well, tell us about your furry babies.
Yeah. Well, I've got 3. My oldest is Maria. She's 15. She's a long-haired Chihuahua Papillon mix. And then I have Ricky Roo. He's a miniature poodle mix. Got him from the shelter.
I love those names.
I know, right? And then my third is Jenny. That was her name at the shelter, but it kind of went with the crew, and she's a little husky mix. So, they keep me busy. They keep me on my toes, and a lot of different personalities too, but it kind of works.
Well, it's so wonderful they become part of our lives.
And they help with stress relief, all kinds of things. Something
really
is really important for maintaining healthy veins.
Stress relief is important.
Yes. But in this episode specifically, without further ado, we want to break into how heart health and how it relates to deep vein thrombosis, peripheral artery disease. I always mess that one up. PAD for short. And let's see, diabetes. That's another one. And just how all of these kind of relate to one another. Speaking of stress and things like that, we're kind of coming off the holidays. It's in February right now, but it's I feel like it feels like Thanksgiving and Christmas were just around the corner, and then you have the celebrating the new year, and then you're giving out chocolates for February for
love chocolate.
Valentine's Day, yes, more chocolate, please.
A lot of stress events and romantic things and disappointments or excitement, and it certainly is.
Food, maybe not so healthy food sometimes. Do you see an increase of patients, kind of after that?
We do, and it's one thing they talk about, the 10-pound holiday that you had on. If the packages suddenly are on our body. But it does happen because we get out of our routines of exercise and healthy diet and that sort of thing. But it's interesting, you mentioned heart and all these other things, and you think they're all different entities, but they're related. And that's one thing we want to let everyone know, is that although it's Heart Healthy Month, but what's happening here is happening in your whole body.
Right.
And when someone has what we call atherosclerotic disease, they get the calcium buildup or plaque in the arteries narrow in the heart, and it has to work harder. That's not just happening here. Your arteries are everywhere, and the same blood's flowing here as down there. And the arteries may be narrowing in the neck, which is, very important to be aware of, and in the legs. And particularly with diabetes, it is one of the characteristic things. If somebody's been a long-term diabetic, 10 years, those arteries are calcified. And we see it all the way down to the toes. Those arteries, is like on an x-ray, they look like they've been outlined with a rough white highlighter all the way down. It's all calcium, like bones.
Man.
Those arteries get more narrowed, and we worry about blood flow to the lower leg.
Is that what they refer to as plaque? Like plaque?
Exactly. That calcium is plaque.
Okay.
Exactly.
Wow. Because you hear these terms sometimes, but you don't really know specifically what they mean.
And they relate that a lot to the fluctuations in blood sugar levels.
Oh.
And when it goes way up and your body tries to get it lower down, a lot of times it's stored as plaque. So sugar is a big factor, and that's what's hard to control with diabetes.
And over the holidays and
Lots of
over Valentine's
Valentine's Day.
Day. Oh man,
Oh
well
yeah.
darn, I guess I'll
Little
have to lay off the chocolates from now
yeah.
on for a little bit. But that's just interesting how it's all related. I mean, the entire body's connected, so it
Sure.
obviously makes sense. But I think like when people go to their doctors, they see a specialist and we kind of
Get
approach the
siloed.
body and
Mhm.
yeah, and like in fragments when in reality
Yeah.
it's all
And
related.
it's so important. We work with all the physicians in different areas, and that collaboration, you get the best of medical care when you do that. We had a patient today,
Yeah.
we were just speaking of that, came in and the doctor had ran an EKG on their regular routine visit, and suddenly they had what they call right bundle branch blocks. Part of the right side of the heart was having abnormal signals. And so they wondered what's
Mm.
going on. And they sent me over and I was visiting with the patient, explaining how, well, we know something is abnormal here, and your cardiologist is going to further evaluate that, but your provider also wants to know, well, how's it infected in the whole body?
Yeah.
Well, when we start looking at the legs, if the right side's not working well, that's where all the old blood from the veins comes up and it goes into the right side of the heart and then on to the lungs. But if this isn't working, you get this solid column all the way up that's distended,
Mm.
and it transmits the sound from the heart, which normally you hear it beating like ka-chow, ka-chow. Well, you hear that in the vein, and normally the veins just kind of go a steady sound as it's flowing back, but it
Uh-huh.
suddenly transmits and sounds like an artery.
Yeah.
So we know if we hear that sound when we're looking at the veins of the legs, we're not only looking for other problems with veins, we can tell there's some problem with the right side of the heart. So when we get that evaluation of the patient, and I'll tell them we'll look for that. And if they have that, it tells us a lot. It will help the cardiologist know that not only is it just an abnormal signal, it's impacting the health of their whole body because that blood can't get back, that side's not working. So it's collaboration,
Yeah.
between the different areas, helping that patient find out what's wrong and how we can get it better.
So does that mean, when the heart's not operating properly and then the veins are then affected, does that mean increased stroke risk? Does that just mean circulation issues in general? You talked about how it's affecting the entire body now. What are some of those symptoms that they might experience when maybe they aren't aware that it's happening?
Well, they may get short of breath.
Okay.
That's one thing that's very common. You just get tired, short of breath. And of
Hmm.
course, if somebody's having a cardiac event, they have all sorts of things. They may have pain in the arm or chest pain, but just kind of chronic when the heart's not functioning correctly, you may have shortness of breath, weakness, tiredness, that sort of thing like that. And but you're correct. If they're not working, got several systems here. You talked about diabetes in the arteries, and if they're not working down here, suddenly your legs, if you try to walk to the grocery store, you can only go half an aisle. And
Hmm.
you stop and have to rest your legs because they're burning. And that
Yeah.
tells us you have what we call claudication. And it gets so bad, sometimes the legs just hurt when they're sitting down, and they have to elevate their legs up
Yeah.
to just be able to drain that extra venous blood out so the arteries can deliver oxygen. So
Oh
it's
man.
something that gets worse over time, but you want to be able to evaluate and see how bad it is. And if that is the case, we come in and try to open up those arteries. And that's one thing that we do. We come in with a little balloon through a tiny little catheter, kind of like a tiny coffee straw. It's a
Yeah.
little bitty thing, and
Tiny
we
little
open
it's
those
pretty.
arteries back up, and we may put little stents. It just depends where it is, but our goal is to increase the blood flow down to the legs.
Wow. And does this affect men and women disproportionately, or do you see about the same amount of cases between men or women?
That's a good question. We see a little bit more venous insufficiency, the veins not working, and which impacts the delivery of oxygen to arteries in women simply because of pregnancy. That's the factor that changes that.
Mm.
But we do see it in both both genders, as far as arterial disease. We see it in both. So it's important that if you're starting to have problems, your skin's changing down here, maybe
Mhm.
it's just scaly. Well, that's a clue. My skin's not scaly and I'm a million years old. And it's a long way from my heart. But
Yeah.
I mean, there's something wrong if we're not getting oxygen and the skin starts being scaly, it gets discolored,
Yeah.
maybe your
Hmm.
your toes tingle. You need to have these things checked out. There's all sorts of systems that can be affecting that.
Wow, so you can really be affected at any age then
Oh,
with
sure.
something like this.
Hmm.
Wow. Okay. That's interesting. And you as you were pointing down at your ankle, I remember your compression socks and how amazing those are from our
Yes.
last episode. Get you some compression socks.
Oh, they're
Just trust
great.
us. If you want to know why, watch the previous episode.
Exactly.
You'll get it. But yeah, so heart health, how it affects the veins and everything, something we learned about recently was deep vein thrombosis, and a big part of that
Mm.
was because Victor Wembanyama had
Oh,
suffered from deep vein
yeah.
thrombosis, but
Mm.
most people didn't even know what that was
And he's not
until,
an old man sitting on a sofa.
yeah, he's
you
a
know,
giant.
young, superior athlete. And
Yeah,
these things can happen for different reasons. Yeah. So,
yeah.
and just never ignore things in your body. Always, talk to your provider, get things checked out. There's a reason you may be feeling or seeing something abnormal.
Yeah, and can you expand a little bit more on what deep vein thrombosis is, why
Sure.
it might affect younger people versus older
Yes.
people, or
Well,
both?
it's basically a clot, a DVT, and those clots, depending where they are, they can sometimes be in the skin veins, but it's important that we treat those also because they can travel right from the skin into the muscle and right back up to the heart. But the danger of the deep vein thrombosis is not only the chronic swelling in the leg and the pain, and it can cause changes, where you may have that leg swollen forever if it's not corrected early. But those clots can travel up and go into the heart, into the lungs. And so that's a dangerous thing.
Mm,
And of course, he had his up here, which is even closer to the heart, but they've got that figured out. I think, as I understand,
yeah,
I did not, of course, examine
yeah,
him,
yeah.
but I think, he has big muscles like
Mm.
just like me, no. But anyway, had
Me
a
too.
narrowed area that was kind of pinched in here and it kind
Okay.
of compressed that vein and made it clot up. And the same thing if you're sitting for a long time,
Mhm.
that blood's not returning. Instead of an obstructing area, not having movement in your legs can cause it. So it's so important. I see patients routinely every week that have been on an airplane. They come in, oh, I got a clot, and you
Yeah,
see that, or they're driving to see their parents or whatever.
yeah,
You've got to remember to keep your legs moving,
yeah.
and what's pumping it back uphill are your calf muscles right down here. And that's what you do when you're walking. You're moving those calves, leave your toes on the ground, pick your heels up. They really teach us. Dr. Trock, our doctor of physical therapy, who is also on our team,
Okay.
he teaches nationally that we should keep these moving every 15 minutes. You should do 15 of these calf raises, or, even when you're seated, do that, or get up and walk.
Yeah,
We were supposed to be walking all day.
yeah.
So that's something keeps you healthy and can help prevent blood clots.
That makes sense because they are flying all the time from
Oh,
games and all over the place, and
yes.
so that all really adds up. Is there a risk of it returning if you've already had DVT? Could it just be a recurrent issue?
Well, that it's a lot of times it has a hereditary factor.
Okay.
So, particularly in a male, if it's their first clot and we don't know what caused it, and so if they've taken a long trip, we might excuse that. But if they've not a reason for it, we call that provoked when we know the reason that caused it. Then we wonder if they don't have a clotting disorder. So we'll send them over to our friends over the Start Center, one of the hematologists, and they're going to start investigating, see if there's something genetic. And if it is, then they may be on blood thinners for a long time, sometimes many years or lifetime. It depends. So, but you want to know because you want to live a normal life and not have life-threatening clots coming up.
Yeah, yeah. It's almost like, especially if you're a guy like Wimby and you have so much. I mean, we all have a lot
Oh,
riding
yeah.
on our life. Like, let's just say that. But
We have it riding on the
I know about
Spurs.
the Spurs. Come on, they're second in the West. We got to stay there. No, I'm just
Mm,
kidding. Yeah, but so I guess taking medication for precautionary reasons
Yeah.
would make sense in that
And
situation.
it's variable.
Yeah.
Just because you have a clot the first time doesn't mean that, but it's something at some point. You want to make sure you're going to a provider who understands that. That's maybe a diplomat, American Board of Venous and Lymphatic Medicine, or board certified hematologist. Somebody really can evaluate that and know if you need further genetic testing or not.
Well, all good
Yeah,
to know. Who would have thought that would be a genetic thing?
yeah,
You don't really associate vein stuff with genetic stuff, but that's good to know. So, you were talking about how you have a really good team here of people who are able to, you have your physical therapist, you just added a new surgeon onto your
yes, that's
team.
right.
And
Dr.
then, yes,
Gutierrez,
Dr. Gutierrez. And then you had talked about how this
vascular
patient
surgeon. Mhm.
that you had just seen recently with the heart issue, they have their doctor. So it's really collaborative effort by the time they're at the medical vein clinic.
It's so important, and I want to speak to everybody out there, providers, and when we get siloed in the area we're working in, and all I'm doing is looking at this vein, looking at this, that's not going to help the patient long term. You've got to be able to reach out and call up, somebody's going to help do lymphatic massage, or talk to their primary care, their cardiologist, or different ones. And that collaboration, it makes a huge difference, the orthopedist. And I pick up that phone and call. In fact, we just had one a while ago.
Yeah,
And
yeah. Right
you,
before we started recording, someone gave him a call, and he's just on call all the time, it seems.
well, it's just so important for
Yeah.
patient care.
Mhm.
That communication, and it's just we see less and less of that as corporations take over medicine, and you're just focused on numbers, and we forget that talking to each other, we learn a lot. I learned things from you today,
Yeah.
Katie. Thank
Oh
you.
my gosh,
So
thank
it's important. We
you.
need to talk.
Well, I learned, I think, a lot more from you than you are from me, but I
Well, I don't know.
appreciate
I
you.
learned a lot.
Well, thank you. Yeah, uh, you know, talking to all of these doctors, and
Mhm.
especially if you have a patient who has multiple issues in different specific areas, I'm sure there's just a list of medications as well. And when you think about how medications affect one another, how they affect the body with
Mhm.
side effects, are there certain medications that you see it on the list and you think, oh, well, that makes sense based on this medication that they might start having some vein issues here or circulation issues there or things
Absolutely.
like that?
It does do that. And
Mhm.
it's interesting you mentioned medications, which is not, what I know a lot about, but thank goodness we have like Dr. Seidel, our nurse practitioner doctor who spent years in internal medicine. We have great providers I call, and our nurse practitioner, I say, what about this medication? Look it up. But so
Okay.
I always, reach out to get more information. But as far as like clotting and things like that, we do see increased clots associated with particularly hormone therapy.
Okay.
It's very popular now,
Yeah.
and a lot of people take replacement therapy of different things. So we see a lot of that. So certain types of things are more prone to clotting, and as such, if we're doing a procedure, we may put them on. Maybe it's just a small, as we call baby aspirin, 81 milligram
Yeah.
ASA, or other things, but we want to know what their medications are. Some of them do tend to cause more problems.
Yeah. And it's always good to be aware of everything
Hmm.
and how they might affect you and all of that.
Sure.
But another topic we wanted to hit on was PAD, peripheral artery disease.
Yes.
How does that relate to the other two, the DVT and the diabetes and
It's all
the
related.
heart?
That's the
Could
funny
somebody
thing
have
about it.
all of these? Could they have
Absolutely,
DVT,
absolutely.
diabetes, and
Yeah,
PAD?
absolutely.
Poor person.
I know.
My
Well,
goodness.
we are the diabetic capital of the
Yeah.
country,
Oh my.
and we don't say that because we're proud, but
Yeah.
genetically we have a lot of it here. Sometimes our diet and a lot of different demographic factors, promote the diabetes that we have. And so when you have diabetes, it does, as I said, start those arteries to calcify, and then they start to have problems with their legs. They come in and they may have an ulcer here, and they can lose their leg
Oh
over time. If
man.
we don't get on that and figure that out, a lot of times the old blood's not getting out of the way. And this is how I explain it to patients, Katie, is if you had a glass here and had been sitting out for a while and it was old water in it and you wanted to get a drink, but you were going to get some fresh water in there, like if this were the glass,
Hmm.
no water can go in there. You have to
Right.
empty the old water out
I
first,
see.
and then you can get the
And
fresh
then you
water in
yeah.
or the fresh blood with oxygen. So
Yes.
we need to make sure that we're pushing that old blood out of the way. So circulation really is two big areas: arteries going down with fresh blood, but the veins have to work to move it out. So, they're important that both of those systems, they're different, but they're very closely related, that both of those are optimized.
Wow. And going back to the diabetes too, has it ever happened? Because you think when someone has diabetes, they go to like a glandular disease clinic, right?
Sure.
But
It's
has it
important.
ever happened where someone has come through your office and they're highly suspect for diabetes and it
Sure.
actually works the other way around?
We do. We have patients coming in because, oh, I see some spider veins or my legs are heavy. And
Mm,
we start talking to them, and, they haven't been to a provider in a long time. And we encourage them, you need to go to your provider. We need to,
yeah.
check, and see what's going on. Maybe they have some skin, something that makes me think they have like a candida or some fungus or
Hmm.
something. And so we'll want to get them evaluated. It's not
Yeah.
something we do, but
Yeah.
again, we're working with our team.
Yeah.
We're calling the primary care to send them to, or maybe it's an endocrinologist,
Mhm.
maybe it's a dermatologist we're seeing. So
Yeah.
the better patient care comes when your providers are all talking to each other.
Yep. All
Yeah,
working
all
together on
working
the
together.
same page.
It's just like
Yeah.
that. The Spurs, you got to have
Yes.
everybody out there playing.
Team
You can't be
effort.
watching. You
Yeah.
all got to work together.
Solid 5 on the bench, at least 10 deep. Yep, I
Boom.
know
That's
exactly.
it.
Yeah, that's right. Let's go Spurs. No, but going back to the diabetes, you'd mentioned like ulcers on the foot. Like, is there at any point in time where where you guys are responsible for like a surgery that might come as a result of advanced diabetes that has caused a lot of vein problems and issues like that?
Right. Well, the things that we're doing here at Medical Vein Clinic, we're doing non-surgical, we're doing percutaneous procedures, and we
Okay.
can go into the veins and we treat those while you're wide awake. Easy procedure, you walk in, walk out. And the arteries, we can come in and open those up. And Dr. Giannis can actually, we inject a little dye to see where it's narrowed. We have a very specialized ultrasound. It's very tiny. It's amazing. Instead of just on the outside, it actually goes inside the arteries or the veins and can take pictures you look at on the inside. It's
Oh,
just amazing,
wow.
the technology.
Wow.
But so we're able to do so much non-surgically. But if it is something that's very serious, we'll go over, and Dr. Giannis will either go over to the hospital and do that in the OR, or have one of the other our colleagues. We have surgical colleagues, we call them, for more complex cases. It might be some problem with the aorta, different things like that. And again, it's having those great relationships so we can help that patient figure out what's going to help them.
And, speaking of procedures, you have a new procedure that just came out. From what I understand, GAE.
That's
What
right,
does that
exactly.
stand for? Because
It
I
is
don't
the
know what that
I
stands
think it's the
for.
coolest thing in the world
Okay.
because, I've had my knees replaced, and thank goodness they're great. I love them.
Oh.
But, a lot of patients are not, maybe they're not a good candidate for
Mm.
surgery,
Yeah.
or they have, no, don't not ready to get their knees replaced, and they've been treating, and there's, we always want to try conservative treatment measures first. And it's sort of for those people who've had maybe injections in their knees, and they're just bone and bone. It just kills them
Oh,
pain. And
yeah.
so what happens if your knees hurt? Do you walk much?
No.
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 And so suddenly that patient's not walking. And really,
Mhm.
walking is our key to health. I can't emphasize that enough.
Yeah.
You walk, you're healthy.
Yeah.
You got to keep walking. And so you don't want your knees slowing you down. Well,
Yeah.
you can't run with your grandkids or your little furry
Little
pets.
fur babies.
Yeah, your fur babies. But so what we have, we're able to do now, there's tiny little artery, tiny little vessel that feeds the area that's making the pain. We call that the inflammation. And medically, it's called a geniculate artery. It's a little tiny thing. And so if we find out where the pain is, and then we can come in and inject, and we say suddenly, oh, there's a big area that's developing, in the area of pain. And so Dr. Giannis can come in again with a tiny little catheter, and you're there, and you walk in, you're there a few hours and you leave. The procedure's about an hour, but they give you a little sleeping medicine.
Okay.
We call it top shelf, just to be a little groggy. But they can come
Not
in
to
and
be
close.
mixed up with vodka.
There you go.
Get
But
there one way or another, right? I'm
yeah,
just kidding.
but
No.
we
Yeah.
can stop that little tiny little artery in that area that's causing inflammation. And it is amazing. Within a week, most patients get 80 to 90% relief of pain. So you can
Wow.
you imagine where your knees are hurting all the time
Yeah.
and you can get that relief. And the nice thing, it's not like it lasts a week or 2 weeks. It generally will last up to 3 years. I mean, they say, patients really 2 to 4 years sometimes, but up to three. And that's, man, if you can go without paying for that time period and get back to walking and lose weight and get
Yeah.
your diabetes better, your blood pressure's better, wow,
I mean,
that's amazing.
huge difference, especially for the elderly population,
Exactly.
especially when they get to that time in their life where they might be in a wheelchair, like trying
Yeah,
to do everything you can to keep them out of
out of
that
that.
wheelchair.
That's
Yeah.
huge. And
Yeah.
that's really what it's you designed for. It's not your first line, oh, my knee hurts, let's go do that.
Hmm.
It's not really can it. With somebody that really is in that, it's affecting their lifestyle and there's not an easy fix for them. And they're, like I said, they might not be surgical candidates,
Hmm.
or whatever. So
Yeah.
there's hope for them with that.
So I guess in this situation, it would apply to somebody who has a ton of pain. They're maybe
Mm-hmm.
not able to walk anymore. They have swelling. Would that
Mm-hmm.
be an indicator that
Sure,
something's
it's
going on
anything
there?
that's
Yeah.
slowing you down. And
Hmm.
pain is not fun,
Yeah.
and it hurts all the time. And
Yeah.
I remember having that with my knees, and I went in and got new ones right away, and they're great now. But that's not always what people can do
Yeah.
or want to do, and
Hmm.
and so it's an option that it doesn't fix the knee.
Hmm.
It's still gonna be bone and bone, but gosh, if it doesn't hurt, that's what's
It
amazing.
helps a lot.
Hmm.
Yeah,
Keeps you
absolutely.
moving.
Absolutely. And probably helps for people as they're going through physical therapy to progress in their physical therapy,
Ah,
especially if
yes.
they get setbacks and then just trying to move forward, because
Hmm.
I've experienced that too with my own family where, they go into a situation where they've been sick and then now they're trying to rehabilitate back to
Hmm.
walking, but then they have these injuries on top of it. And,
Yeah.
it makes me wonder if that wouldn't be something that could really, really help my family
It
too. I'll
really
have to
does.
look into that.
If you can get rid of pain, you're going
Yep.
to move, and you have
Right.
the desire. You have to
Yes.
want to
Oh,
move and want to
totally. Yeah.
walk. But
Yeah.
if the pain's stopping you, better think twice about that.
Okay.
You need to figure that out.
And that is called GAE.
GAE.
Okay.
Mm-hmm.
Very cool. And what are some of the other procedures? Because we're going on our third podcast now. We've
Mm-hmm.
talked about a lot of really cool things between spider veins and chronic pelvic pain. I think we've really hit on a lot here.
Mm-hmm.
What are some of the procedures that you see people coming in for the most?
I think one of the things I see patients coming in, they say, "Well, I have some spider veins," which you see that, but then I'll get them to cross their leg, and I say, "Well, do you see this dark area down there?" I said, "Yeah, I've always had that." Well, it's kind of building up, and that's the rust tattoo. That's iron from the dead red blood cells because the veins weren't
Oh.
working. And then I press right there, and I say, "What's that dent?" They say, "I don't know. I've not seen that before." But people don't pay attention to the lower leg that much. That's all the extra fluid building up edema. And that just progresses and progresses. So we do see maybe it's something minor that brings them in, but
Hmm.
it's good it brings them to the hospital,
Right.
or I mean
Right.
to the clinic.
Yeah.
You always want to go to your provider when you're having trouble. And so we find out what's causing the spider veins. We can fix the source of the problem and eventually address the little ones on the surface. But um, in our world, we want to find out what problems are causing it.
Yeah.
Sometimes it could be a tumor up here. We
Yeah.
find that not uncommonly
Hmm.
pressing on the vein. So we
Hmm.
find all sorts of things, and we want to follow that patient, and I get them referred right over to an oncologist,
Yeah.
or maybe a special surgeon that works on tumor resection. So
Yeah.
again, you want to go if you're having trouble, see your provider and follow up on it.
Yeah. And within this time, you've given us so many, other things that you can work on, pumping your calf muscles and walking often and dietary changes, things like
Yes.
that, that you can take your health into your own hands in a lot of ways. But if you've kind of crossed that line, then that's why you have Dr. Hogg, and you can come here and
Well, thank you.
lots of different options, and also a team of specialists. I mean, it's hard
It
to find
is.
that sometimes in one clinic.
It is. And, that's what, although I may be talking to the cardiologist or the hematologist or, different ones everywhere like that, it's so important. And I consider them part of my team also.
Yeah.
They're not under our building here, but they're very much a team providing good care. And you want to make sure your provider is talking, that they're calling and they're getting referrals and getting you the best of care. And when you get that whole network of people, it's like the Spurs. We're
Yeah,
going to win.
I'm gonna win. Go team, go.
Go.
Well, thank you so much, Dr.
Thank you,
Hogg.
Katie.
Again, you're just such a breeze to talk to, so
Oh,
easy to
you're the
talk to.
best.
Just love it.
Thank
And
you.
if they need to contact you, it's
Yes,
medicalveinclinic.com.
ma'am.
And all your social media handles are Medical Vein
Well,
Clinic as
thank
well. So
you.
easy to find if you
Oh,
need them.
we're
But,
here in Stone Oak and then over there in Alamo Ridge too.
okay.
So
Well, thank you.
thank you. My pleasure, Katie. Thank
You
you.
too.
Thank you.